Welcome to today's finalist briefing. Please note today's call is being recorded. Before we begin, we have a few housekeeping items. Today you will hear from MacArthur Managing Director Cecilia Conrad, who oversees 100&Change, and 100&Change finalists, who will then take questions. Participants' lines are muted. However, you may enter a question at any time during the conference simply by typing it in the question box on your screen and then clicking the send button. I would now like to turn it over to Cecilia Conrad.
Good morning. Thank you for joining us today as we announce the finalist for 100&Change, our global competition for a single $100 million grant. When we started this competition, it was guided by three principles. First, in most of the foundation's work, we carefully select our areas of grant making and design strategies for maximum impact. But we recognize that we don't know everything. We wonder, what are we missing? And this competition, a call for solutions for any problem from any organization located anywhere, reflects our desire for openness to what we don't know, which can be so important in philanthropy. The second is that we hope that by funding at a level far above what is typical in philanthropy, we will be able to address problems and support solutions that are radically different in scale, scope, and complexity. And then third, we believe that solutions are possible to even some of the most challenging problems facing the nation and the world. And that optimism, that inspiration is even more critical today given the political and social context we all face. We were pleasantly surprised at the robust participation in 100&Change. We had nearly 2,000 proposals and identified 8 great semifinalists. MacArthur's board of directors met in person over 2 days last week to carefully consider this decision and to talk with leaders of each team. The board looked at the strength of the team and its partnerships, the viability and credibility of the proposal, and the team's ability to sustain the project's benefits over the long term as it reached its decision. It was not an easy decision. All 8 semifinalists are great, and we hope that all get attention and funding and are able to proceed with their important work. And now to announce the 4 finalists. Catholic Relief Services. Catholic Relief Services will change how society cares for children in orphanages. The team will work in Guatemala, Haiti, India, Indonesia, Kenya, Lebanon, and Moldova to promote deinstitutionalization and a transition to a family-based system of care with the financial and institutional structures to support it. The team has developed an international network of care leavers, people who have who've grown up in the system, in an institutionalized system, and have now transitioned out of it, to advocate on the behalf of children in the care system. Harvest Plus is our second semifinalist. Harvest Plus will eliminate hidden hunger by fortifying staple crops in Africa. The project promises to increase farmers' incomes in addition to improving intake of nutrition. By 2022, the project will reach 100 million people in 17 African countries with 7 biofortified crops. Our third semifinalist, Rice 360 Institute for Global Health, a Rice University Institute. Rice 360 will improve newborn survival in Africa. The Newborn Essential Solutions Technology, or NEST, will design and or distribute a suite of life-saving neonatal care technologies adapted to low-resource settings, with the goal of saving the lives of 500,000 African newborns annually. It will also create a pipeline of future clinicians and innovators dedicated to improving newborn health into the future. And our fourth semifinalist, Sesame Workshop, an International Rescue Committee, will educate children displaced by conflict and persecution in the Middle East. Sesame Seeds is an evidence-based early childhood development intervention designed to address the toxic stress experienced by children in the Syrian refugee region, Jordan, Lebanon, Iraq, and Syria. The project will improve children's learning outcomes today and have a beneficial long-term effect on their intellectual and emotional development. Beginning on September 29th, we will hold a weekly opportunity for the public to engage with these finalists, and they will present their proposals on December 11th to a live Chicago audience of funders, nonprofit leaders, experts, and others. That event will also be live streamed. Shortly thereafter, we will select and name the winner of the competition. In 2018, we will make information available about the next round of 100&Change. I want to say congratulations to the semifinalists. Congratulations to the finalists. We hope that 100&Change can spark a conversation and inspire individuals and organizations to be bold and think big, because solutions are possible. And we hope to have one of those conversations today. We have a representative from each of the finalist organizations who will speak, and then we will open it up to questions, which I will moderate. First up is Shannon Feld, Senior Vice President of Catholic Relief Services. Shannon.
Good morning. I'm thrilled to have this opportunity to talk about the 100&Change competition and our selection as a finalist. Changing the Way We Care brings together three organizations, Catholic Relief Services, Lumos, and Maestro International, to solve the growing problem of children living in orphanages around the world. We are so grateful to the MacArthur Foundation for selecting us as a finalist in this competition. We feel our selection as a finalist is a critical next step in solving this global problem, the proliferation of orphanages that often do more harm than good, and the false belief that children are better off in orphanages than they are with their families who love them. We know that almost all children in orphanages, 80 to 90%, have living parents. Most often, it's poverty driving these families apart. Parents believe, or they are told, that their child will be given a better way of life if they live in an orphanage. However, decades of research shows that orphanages negatively affect the development of children, leading to increased risk of abuse and social problems later in life. We also know that children in orphanages are 4 times more likely to be victims of sexual abuse and 6 times more likely to be victims of violence than those in family care. We are committed to informing the public about these issues so that we can redirect donor dollars toward a long-term solution that supports families. Changing the Way We Care will return these children to family care by providing the critical support families need, while also preventing many children from needlessly entering orphanages in the first place. The love and care of family is what every child needs to thrive. We are so thankful to the MacArthur Foundation for shining a light on this urgent issue. Thank you.
Thank you, Shannon. Next, we will hear from Sesame Workshop Executive Vice President Sherri Weston and International Rescue Committee President and CEO David Miliband.
Thank you so much, Cecilia. First of all, we are so honored to be selected as a finalist among these incredible organizations. We want to especially thank the MacArthur Foundation, not only for the opportunity you've given us, but also for the leadership and vision you've shown in creating 100&Change. So Sesame Workshop and the IRC are embarking on what will be the largest early childhood intervention in the history of humanitarian response. Together, we'll reach over 9 million children affected by the Syrian crisis with evidence-based early education through both mass media and direct services for 1.5 million of the most vulnerable. You know, few Syrian children have opportunities to learn and play. Some have been exposed to extreme violence, and many are at risk for what's called toxic stress. So our partnership harnesses the unique strengths of both organizations to deliver early learning and nurturing care at mass scale. It combines IRC's extensive on-the-ground operations with Sesame's proven research-driven educational content designed to reflect these children's language, culture, and reality, all with engaging characters with whom we know children connect deeply, giving children a path forward. David?
Thank you very much, Sherri. I want to add my thanks to the MacArthur Foundation. There is no greater global problem than the refugee crisis at the moment. 25 million refugees and asylum seekers, 40 million internally displaced. And there is no more vulnerable group amongst that population than children, And tragically, there is no more underserved group than young children. The good news is that we have the evidence and the know-how to make a real difference. Sesame Seeds is a transformational initiative that will give hope and opportunity for the first time to literally millions of young children, and also change humanitarian programming around the world for years to come. We know that early education in crisis situations is a sector without leadership. We believe that the MacArthur Foundation has the opportunity to provide that leadership, and we are honored to be able to help them with it. Thank you very much indeed.
Thank you, David and Sherri. Rebecca Richards-Quartum, founder and director of Rice 360 Institute for Global Health, will speak next.
Thank you. On behalf of the NEST 360 team, I want to thank the MacArthur Foundation and its board for naming us a 100&Change finalist. NEST 360, it first took root in Malawi, the warm heart of Africa, a continent where more than 1 million babies die every year, mostly from causes we can prevent. Doctors and nurses there are frustrated that their hospitals lack the technology that is needed to provide newborns with quality, comprehensive care. Technologies that have been available in the United States for more than 50 years. But this equipment is not built to last in the harsh environments of African hospitals. Team NEST 360's goal is to ensure that a baby born in Africa has the same chance of survival as one born in the United States. To achieve this goal, we will deploy NEST, a package of newborn essential solutions and technologies designed to reduce newborn deaths by 75%. We will ensure access to these life-saving innovations by generating large-scale demand for technologies and developing new distribution systems for their affordable delivery. We will sustain their use by educating the next generation of biomedical innovators and a pipeline of clinicians able to lead systems change to improve newborn health. With support from 100&Change, NEST will catalyze continent-wide change within a decade, saving the lives of 500,000 newborns every year at a cost of only $1.48 per birth. We are so grateful for this opportunity, and we look forward to working towards this goal alongside the MacArthur Foundation in the coming months. Thank you.
Thank you, Rebecca. And now we will hear from our fourth finalist, Harvest Plus CEO, Beth Postma.
Good morning, everyone. And on behalf of the entire Harvest Plus team, we're deeply honored and grateful to have been selected as a 100&Change finalist. We congratulate all of our fellow finalists, and we admire the inspiring work of all of the other organizations in the competition. The problem we're tackling at Harvest Plus is serious, yet largely overlooked. This is why it's called hidden hunger. Being selected as a finalist brings much needed attention to this problem and our solution. 2 billion people worldwide currently suffer from a lack of vitamins and minerals. They may technically have enough to eat, but that food is not very nourishing, which undermines children's health and ability to learn and grow. Our solution, biofortification, is the process of breeding these much needed vitamins and minerals into everyday food crops. 26 million people are already benefiting. In our 100&Change proposal, we laid out plans to reach 100 million people with biofortified staple foods in 17 countries across Africa over the next 5 years. 100&Change will empower us and our partners to reach millions more vulnerable families. The competition has challenged us and strengthened us. Over the last year, we've engaged with a broad array of stakeholders and incorporated their feedback into our proposal. Thanks to the MacArthur Foundation and their expert advisors, we have sharpened our focus on issues like including more people with disabilities in our programming. Developing a detailed project plan with their advice has really laid the foundation for scaling up. We are so excited about the next stage of the competition, and we wish everyone luck. Thank you very much.
Thank you, Beth, and thanks again to all of the finalists for inspiring us and joining us on today's call. Now we are open to take some questions. So you can type questions in the question box and I will screen them. And as we wait for the first question, I think I'll kick it off with a question that we hear often. How will $100 million be catalytic? What can you do with $100 million over 3 to 5 years that you could not accomplish with $10 million a year over 10 years? And I think to kick off that question, let's start with Rice 360.
Thank you so much. And we've thought a lot about that question. We have scaled one technology, which is a component of Nest. And we developed a system to help premature babies breathe that improves survival rates by more than 2 for preterm babies. We've been able to scale that to 30 countries with an investment of about $5 million. We know that to provide all of the technologies that babies need to end preventable newborn death, it takes a group of about 17 technologies. And so an investment of $100 million allows us to think about how we can really solve this problem in a comprehensive way at scale.
All right, Sesame IRC, would you like to tackle that one?
Thank you very much. I mean, I think your question was why not take 10 years? And the answer is go and tell the Syrian children in Jordan, Lebanon, or Iraq that you're not going to solve their problem now. We're at a moment of real inflection in the global refugee crisis. There is urgency amongst the children, and frankly, there is a lack of leadership in the humanitarian community. What the $100 million over 3 to 5 years offers us a chance to do is not just address the immediate chronic needs of the refugee population that's been displaced from Syria. It also allows us to be a catalyst for change in the wider humanitarian system. At the moment, less than 2% of the global humanitarian budget is spent on education. In the Jordan Refugee Response Plan, less than 0.04% is deemed to be spent on early childhood education. This is a sector, and frankly, these are children crying out for some adult leadership. And that's why it's so important that we address this problem head on, prove the concept that is already evidence-based, and show that the world is not going to neglect the next generation.
Thank you. Let's hear from Harvest Plus.
Hello. Well, the $100 million is necessary to change a problem, a system, a food system that is fundamentally broken. Nutrition is one of the toughest things that we need to change in our world today. I can't bear the fact that we have 2 billion people suffering from not getting enough nutrition at one end and 2 billion of people that are suffering from obesity and overweight issues at the other end of our food system. We need to scale up the solutions that are working. And as a global society, we're not always good at backing the best horses. There's not enough money to go around. We throw a lot of money at small projects. Finding those that truly have an opportunity to save lives and go to scale is really what this competition has inspired us all. And at Harvest Plus, after 13 years of research and development, we have a solution that is scalable. We not reaching tens of millions, we're able to reach 100 million people over the next 5 years. And we can do this across 17 countries in Africa. And this tackles some really truly fundamental problems in these societies where 370,000 children are going blind every year just because they're not getting enough vitamin A in their diets. 470,000 children are growing up stunted with impaired cognitive abilities because they're not getting enough iron or zinc in their diets. We can fix this. We have a solution, and we now need that catalytic push to help governments and our partners. We work with over 400 partners in these countries to truly embed these crops into everyday lives and become part of the food system. And with $100 million, we believe we can get to that walkaway point, and this will become truly sustainable. It's the gift that keeps on giving, and it will solve one of the world's biggest challenges.
And finally, let's hear from Catholic Relief Services. How will 100 million over 3 to 5 years be catalytic?
Thank you, Cecilia. It's precisely for that reason that we're so excited about the MacArthur Foundation's 100&Change. We know that there are at least 8 million children in care. We estimate that that is actually a higher number. We're talking about one of the most vulnerable groups in the world. They're not even counted. There is no voice that they have. We know that the 100 million would actually help us change a global system that's unfortunately wrong, but funded by those who want to do the right thing. So it's a system that's funded by well-meaning individuals and oftentimes governments and donors trying to take care of vulnerable populations, but taking care of them in the wrong way. We believe that with the $100 million from the MacArthur Foundation, we will actually be able to deinstitutionalize the children in the countries where we're working, but also really bring that catalytic moment to bear at the global level and change that global system. The $100 million investment from MacArthur, we believe, will actually unlock more than $1 billion of other funding that's out there and redirect that in positive ways. It will help us to prevent more than 5 million more children from ever entering care, as well as deinstitutionalizing those children who are currently in care. We believe that over that 5-year period, we can really push forward, and we'll be able to push past the point of no return, and really do believe that this is that moment of catalytic change that can happen for the entire world.
Shannon, you made a reference to the notion of how you might sustain your solution over the long term. And that's another good question that we have here, and that is, what will happen when the grant ends with your projects? Shannon, do you want to add any more to that? And then I'll work back through the other finalists.
Sure, that's a great question. Our project is designed around the premise that it is a sustainable solution that we're creating. We know that there's already funding that's going in to support institutional care of children around the world, both from international donors as well as well-meaning individuals that exist in the US and Europe, and also local governments. Unfortunately, a lot of that money goes to support institutional care now instead of supporting children in family-based care. We have experience redirecting that funding, and we believe that bringing this to scale means that we will be able to redirect more funding in the long term. So this will be a sustainable solution that the current funding levels will be more than able to sustain. It costs about 10 times more to take care of a child in an institution than it does a child in a family. So by unlocking and redirecting some of the donor funding that is currently out there, we know that we will be able to provide long-term solutions to the families who need it most.
Thank you. Let me pose that question now to Harvest Plus. Beth?
Thank you very much. I must give credit here to the founder of Harvest Plus, Dr. Howdy Buis. Now, as an economist, this was one of his greatest focus areas, that this needed to be sustainable and it needed to have a walkaway point for Harvest Plus. And the reason why biofortification is so sustainable is that once it's bred into the crop, it stays there, it doesn't disappear. And so once we've managed to work with enough farmers, enough partners to switch out the current unbought biofortified version with a more nutritious version, it's a like-for-like switch. There's no behavioral change required by the family. They go from instantly getting a more nutritious version of the very foods they're eating every day. And once we've been able to work with those farmers so that they can grow and earn a living from these crops, we connect them into value chains in all the countries we work in, and ensure that there's a sustainable supply chain. There's a customer at each point, and there's people making profit along the way in a fair, inclusive, and equitable way. Once we've achieved that scaling and anchoring point, we've got evidence to show that a natural diffusion continues to take place, and that these crops scale by themselves because they're just part of the food system. And therefore, a sustainable solution to nutrition has been something that's been out of reach. But the world has seen successes with giving children supplementation and adding fortification to processed food. but many of these interventions don't reach the rural populations who are growing and consuming their own crops in Africa. And with supplementation, you have to keep going back every 6 months and giving a child a new tablet. This is truly sustainable. It's the most cost-effective way of solving hidden hunger and malnutrition and giving farmers a living and an income so they can lift themselves out of poverty and afford a more diverse and nutritious diet. It has a win-win, and that's what's so truly exciting about it.
Thank you. Let me turn now to the Sesame IRC, David and Sherri.
Thanks very much. Obviously, we've proposed to build a model of early childhood intervention that isn't just appropriate for the Middle East. It is going to be used around the world for refugee children from the Rohingya who are now in Bangladesh, to displaced children elsewhere in the world. The good news about your question is that you don't have to take my word for the fact that sustainability is built into the proposal. You just have to look at the endorsement of the World Bank president who wrote in support of the proposal, the support of UNICEF, the support of government departments, the support of philanthropic foundations, and interestingly, the support of other NGOs who are waiting for the kind of $100 million leadership that the MacArthur Prize offers and are ready to build on this success. So we are confident that in a sector where, as I said before, education is less than 2% of the global spend, we're confident that this kind of initiative would have sustainability built into it from the beginning, both for the children who will benefit, both for the humanitarian sector that will be able to access it, but also for the governments and the philanthropists who are waiting for this kind of leadership and are determined to come in behind it.
Thank you. Now I think we have Rice, Rebecca.
Yes, so our project is leveraging the global attention that is focused on ending preventable newborn death. In 2014, all 194 member states of the United Nations made a commitment to end preventable newborn death by 2030. And data from middle-income countries and high-income countries tells us we cannot achieve that goal without technology for quality comprehensive care. We know that governments and nonprofits and private hospitals, they actually have money to purchase this technology, but when they purchase technology that was designed to be used in high resource settings, what they find is that technology quickly fails in the harsh environments of their hospitals, and it ends up in what we like to call the equipment graveyard. What they need is affordable, rugged, effective technology, and that's what we have designed. But we also know that distribution systems in this geography are really challenged. And so we will establish a nonprofit distributor that will sustain beyond the end of the 100&Change grant. But I think the most important thing that we are doing to focus on sustainability is that we are partnering with engineering schools in Africa to train biomedical technicians who will be able to maintain and repair technology, but to train the next generation of biomedical innovators. They will be capable of designing technologies to solve other health challenges like maternal health or the challenge of chronic disease. And it's this investment in the next generation of innovators that will really lead to sustainable systems change.
I'm sorry, I was on mute still. Thank you very much. Just to remind everyone, we have the 4 finalists for the 100&Change competition on the line. Rice University, Harvest Plus, Sesame IRC, and Catholic Relief Services. And they are available for your questions. So please submit any questions that you have through our question box here at the webinar. In the meantime, I'd like to ask the teams about their engagement with local communities in the areas that you'll be serving. Sometimes projects get criticized for being top down, for sort of parachuting in with solutions to local problems. Could you talk a little bit about what your work and how you've tried to avoid that issue? And I will start with rice.
Well, thank you. That's something that is really important, and I think at the very heart of the solution that we have proposed. Our project really begins by partnering with local physicians and nurses and understanding the challenges that they face in delivering care. And we've been working in Malawi to do just that for over 12 years. We have expanded the geographic focus of our project as we were sharpening our plans for scaling. And we reached out to physicians in Tanzania and physicians in Nigeria, as well as officials from the ministries of health. And one of the most interesting and I think exciting things that happened through that process of community engagement was that we found officials in the ministries of health advocating for technology, but advocating even more strongly to educate the technicians who would be able to care for, maintain, and repair those technologies, and advocating for education of biomedical engineers. And we've expanded the network of schools that are part of our team in response to that to ensure that we have a sustainable solution.
Thank you. Shannon, I referenced care leavers in my original introduction. So maybe as part of your response to this question, you might say a little bit more about that.
Yes, absolutely. So care leavers are those folks who are now adults who predominantly have left orphanages, who oftentimes grew up in orphanages and now are dealing with the consequences as adults for what that means for their lives. As part of our proposal, we really did take a very grassroots approach, including consultation with care leavers to hear about their experiences, get their recommendations on how things might have been done differently. We spoke with families who have placed their children into orphanages, as well as families who've been reunited with their children after the children have left the orphanages and come back home. We also spoke with caregivers at different orphanages to get their perspectives on what they think should actually be happening. We talked with governments in all of the places where we'll be working and really had overwhelming support from the local governments to really engage with us and asking for support on how to make this happen. Another one of the hidden problems of orphanages is that a large number of the children who are actually living in orphanages have some sort of disability. So in some countries, it's up to 60% of children in those orphanages actually are living with a disability. So we actually also did quite a bit of consultation with folks with disabilities, with different disability organizations and different groups to make sure that those perspectives were also incorporated into our proposal. We also met with donors at all levels. So we met with multilateral donors, global institutions, international finance institutions, to hear about their policies, what they fund, and how they might like to change. And then we did a whole series of conversations with private donors. So a lot of well-meaning donors who give to orphanages thinking that they're doing the right thing and not really fully understanding what the real issues are. And so talk to them to ask them how they would like to see the future, what they actually want to have happen with their donations, and how we might help them to change the way that they care about the world's children. So we really did take a very comprehensive approach and really started at the grassroots level to actually shape our entire design. Thank you.
Beth from Harvest Plus.
It's great hearing the other stories, because I think the learnings are all very similar, that these solutions cannot go to scale unless they are community based. And everything we do at Harvest Plus starts and finishes in the local community. Food is deeply personal, and it doesn't matter whether you're getting enough to eat or whether you're challenged with what to get to eat. This decision is made at the family level and usually at the mother level. And so most of our staff, the vast majority of our 170 staff, are based in the countries where we deliver solutions and work with the farmers. We start very early on by visiting our nutritionists, visit local communities and villages, talk to the farmers, talk to the mothers, and understand what crops they're already eating and growing. Our goal then is to create a like-for-like switch. We understand even things down to the color and the shape of the bean, so that we're not requiring a behavioral change. Our agronomists will look at the existing foods and try to match them with an exact same copy, but with extra nutrition built into that crop. So in Rwanda, it's quite a small country, but there are 14 different types of bean that we need to produce with high iron in order to ensure that we are giving the local communities access to exactly the same type, shape, color, taste, smell bean that they're used to. And that requires a huge amount of community interaction. We can't just fly in and out and do this from Washington, DC. This is our countries working day in, day out with the Rwandan communities. And we do this across all of the 6 countries we currently have offices in Africa at the moment. Once we've identified the type of food that we need to enhance, we then work with the national agricultural system, the government of that country, so that we can bring a new variety of those crops into the seed system of the country. So we give away the germplasm, the planting material, to the government, and we work with them to release it as a national seed for that community. And then we work with them to reach out to farmers through farm gate, demo plots, and extension services. We work with over 400 NGOs and partners, and our goal is to help them embed biofortification as part of their existing programs. So where we work with villages, we work with existing NGOs that are already providing hygiene, health, and sanitation advice to families in those communities. And all we do is we help them add the biofortification message into their work. We then work with extension services that are helping farmers improve their agronomic practices, providing forecasting, planting, sowing, harvesting, post-harvest loss information and advice. And we ensure that biofortification becomes part of that default setting of services that are being provided. After that, we work further downstream. We identify where any bottlenecks or barriers are for farmers being able to sell their crops or exchange them in local marketplaces. We identify and work with seed companies to de-risk their businesses and encourage them to switch out a percentage of their portfolios so that they're producing and selling enough biofortified seeds to farmers. And this means that gradually these varieties just become embedded into the food system. And that's why they become sustainable and part of the local economy as well as part of local diets. And we've been so excited to see how quickly, particularly mothers, switch over to these more nutritious varieties because they're seeing the impacts in their children very quickly. Within a month of consuming the biofortified orange sweet potato or the maize, we're seeing a reversal in night blindness in children. And within 3 or 4 months of regular consumption, we've now got evidence that we're seeing a 50% reduction of childhood diarrheal diseases in Africa. And these things mothers deeply care about. So the uptake, we don't now have a demand problem, we have a supply problem. We need to scale up.
So Beth, I'm going to interrupt there. We do have a question that's come in. So I want to turn to Sesame IRC. And a question we've come in is that how old are your organizations or teams? How long have you been working together? How long is the host organization? And then you can also address my question about on the ground connections. So I'm turning to David and Sherri now.
Cecilia, this is Sherri. So our relationship, our partnership with the IRC actually goes back before 100&Change. We came together specifically to address the refugee crisis and bring early education to displaced children. So we are committed to this work. We are thrilled that we're a part of 100&Change, but that's a partnership that goes back and that we've done because of our shared commitment, and we think that our two organizations complement each other so much in terms of our strengths. I would like to speak to what your previous question about on the ground, because we're already in a pilot phase in the region, and we're working very closely on the ground with the communities we serve, and research is such a critical component to everything we do. So if you understand from Sesame's experience, and Sesame Workshop is about to be 50 years old. So we have almost 5 decades of experience of creating content in developing countries around the world. And it is so important when we go into these countries and we create local adaptations that they are just that, local. So our first step is meeting with and enlisting local educators, local ministries of education, local experts on the various challenges and topics that we intend to address. So whether that's gender or cultural diversity, disabilities, we are always including those whose perspectives will help inform that content and what we create. We are on the ground talking to direct service providers, talking to caregivers, talking to parents. I mean, to be in the refugee camps with IRC, bringing our Muppets, doing community viewings, doing the research, testing children's reactions, their engagement. I can't, that's such a critical part of everything we do, but it's also informs every bit of the content we create, and of course informs the curriculum and our impact, so that we're always iterating. The other thing I would say is it is what makes our work so effective in these countries. We are reflecting their culture. This content is designed to meet these children's needs, to reflect their reality. We take our proven evidence-based content. We know our model works, but we create it in such a way that it has the greatest impact for these children, whether that's, you know, HIV and AIDS in South Africa, girls' education in Afghanistan, autism right here at home, including those who know best, and informing what we create so that we can make sure that we're having the desired impact is critical to everything we do.
And you asked how old, I think, are the organizers. Is that what you wanted to know? You want to know how old, not how old am I, but how old is the organization? So the International Rescue Committee was founded at a moment that I think has historical relevance today. We were founded in the 1930s by Albert Einstein to rescue Jews from Europe, and we did so. And we branched out in the last 25 years to become not just a refugee resettlement agency in the United States, headquartered in New York, but also an international humanitarian aid agency working in 30 countries. And the importance of local engagement, which is what Sherri spoke to, is that we know that we are most effective when we are properly embedded in the local community. That's why more than 90% of IRC's 13,000 staff and 10,000 volunteers are local people. And so if you go to our programs in Jordan, it's Jordanians who are staffing it. If you go to our programs in Iraq, it's Iraqis who are staffing it. And that's the way we achieve the benefits of international global footprint, but also local engagement.
And Rebecca, how long has the RICE project been underway, and particularly your partnership with the University of Malawi?
So we have been working in very close collaboration with the University of Malawi, with its College of Medicine and with its College of Engineering for over a decade now, for 12 years. We're joined in our 100&Change proposal by the London School of Hygiene and Tropical Medicine, Northwestern University, and Third Stone Design, and we have decade-plus collaborations with each of those institutions as well. And our team comes together at a really interesting time, because more women now in Africa are delivering their babies in hospitals, but that has not led to improvements in newborn survival. And so we're at a really critical time. Women are coming to hospitals to have their babies, but because those hospitals lack the equipment that they need, that's not translating into survival, improvements in survival. And so 100&Change offered an opportunity for our team to come together and create a plan to really change that situation. I think for too long, we believe that newborn death in Africa is inevitable, and we are ready to put that myth to rest.
Thanks. I'm going to ask for fairly quick answers from our last two teams as we are coming close to the end of the press conference. in terms of the age of your partnerships. So let's go to Harvest Plus next. Beth?
Yes, very quickly. So we were launched in 2003. We're the product of a joint venture between two very well-established research institutions, the International Center for Tropical Agriculture, based in Colombia, and the International Food Policy Research Institute, based in Washington, D.C. The team has grown from its founder, Dr. Howdy Buis, to a team of 170 global staff, of whom 90% are based in the 6 African countries where we have our more established operations. So it's still growing, and we're looking forward to growing that to cover 17 countries in the next 5 years.
All right, and Shannon, with your partnership with Lumos and Maestro?
Sure. So CRS, Lumos, and Maestro have all been working on this issue of children and family-based care for decades, to be honest. Lumos is probably the youngest of our partnership, but CRS and Maestro have been working together for the last 5 years or so to really expand the scope of the work that we were doing. Maestro having a very particular focus on child protection systems in the countries where they work overseas. And CRS has been around for almost 75 years now, in about 110 countries, and has been focusing on this issue for decades now and trying to change the way that we care. We started all 3 working together several years ago, recognizing that we could actually affect more change together if we harnessed our collective energies and expertise and brought them together. And so we've been doing that on a smaller scale, and 100&Change really pushed us to dream bigger than what we could currently do, and challenged us to think about what might be possible without the limitations that we placed on ourselves in the past. And so thank you for pushing our partnership to the next level.
Well, thank you to all of the teams and all who have participated on this call. Let me remind you that beginning Friday, September 29th, we will be holding a weekly opportunity for the
We'll have an opportunity for everyone to participate in digital engagement events that we are calling Finalist Fridays. You can view those on our website at www.macfound.org/100&Change Finalist. And please follow us on social using the hashtag 100&Change. And with that, we must conclude today's press conference. A recording of today's call will be posted on MacArthur's website later today. Thank you for participating, and now you may disconnect.
Thank you all. I'm sorry I went on mute for a second. Thank you.